Well, thank you, Mr. Speaker. Last month, Alberta Health pulled out its metaphorical mortal and pestle and proceeded to grind the pharmacy profession. Now, while this NDP government likes to brag about how it has preserved frontline public services when it comes to community pharmacy, that boast rings hollow. The recent pharmacy funding agreement includes cuts that will jeopardize the health of vulnerable inner-city residents that were provided through the award-winning Adherence and Community Engagement, or ACE, program to the minister. Why have you approved a framework that will harm some of Alberta's most vulnerable citizens?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I certainly want to say that our government values the role that pharmacists play in supporting the healthcare needs of Albertans. And under this new framework, Alberta pharmacists continue to be compensated at a rate higher than their counterparts in other provinces. We think that that's appropriate, and we think that the Alberta Pharmacists Association stepped up to the plate, worked with us to find a way that we could see that 4.3% increase go towards volume increases and the number of medications, as well as population increases, Mr. Speaker. That's where the increase should be going. We think that it's important to look at other jurisdictions, find ways to be efficient, and that's exactly what we did.
First supplemental.
Well, Mr. Speaker, given that every decision made by government must be analyzed in terms of the full economic impact, and given that Alberta Health's many highly capable bureaucrats must have provided and projected this minister an increased overall health care cost estimate caused by withdrawing these critical pharmacy services to the minister, what was that number? How much will health care costs increase because of the cuts to frontline services caused by the new pharmacy funding framework?
The Honourable Minister.
Again, I want to thank pharmacists for working with us to keep costs down and make sure that they're sustainable for future generations. The association recognizes the current fiscal environment in our province, the need to reduce the growth of the healthcare system spending, and a 12% increase, or in excess of that, that was reached under that member's former government, was not fair or reasonable or sustainable in the long term. So what we did is we sat down and we said we want to make costs more affordable for Albertans, which includes reducing the number of times they need to fill prescriptions, so that seniors, about over 1,000 seniors in Alberta, are going to be saving more than $100 in their own pockets. That's because of work this side of the table did, Mr. Speaker.
The Honourable Member, second supplemental.
Well, Mr. Speaker, given that the increase in overall pharmaceutical cost has much more to do with the increased cost of the drugs and not the druggists, and given that award-winning programs like ACE cut ER visits by an estimated 60%, saving countless dollars more than the small amount that this program costs to the minister, I want to believe that you had no idea that the new framework would have this effect. So will you agree to meet with the ACE program pharmacists to discuss restoring funding to this vital community health program?
The Honourable Minister.
Thank you, Mr. Speaker. My health officials have already met with ACE, and we will continue to work with them. And we are, of course, keen to make sure that we find ways to continue to grow opportunities for people to receive care as close to home as possible, Mr. Speaker. I respect the question. I wish the member asking it would respect the fact that I'm answering appropriately and saying that we're going to continue to work with them and give them opportunity to work with us. And I will treat you with respect and would like you to do the same for all Albertans, including those who are accessing these services, Mr. Speaker.